Hello, Namaste, I'm Dr. Amit. So in the last few videos, we talked about tissue distribution of adrenergic receptor, cholinergic receptor and dopamine receptor. Now today we'll move forward in our pharmacology video, and today we'll talk about tissue distribution of histamine receptors and how it actually works in different parts of our body. So let's talk about tissue distribution of histamine receptor. Okay, so before we begin, let's first understand a little bit about a brief introduction about histamine. Okay, so histamine is nothing, it's simply a chemical mediator that is stored mainly in our mast cells and basophils. Okay, and these histamines are released during allergic reaction in our body, and then during anaphylaxis, in any inflammations, and in any injury. Okay, and in any tissue injuries. Okay, so today we'll talk about H1 and H2 receptors of histamine. Okay, so let's learn a simple rule that H1 is and H2 both are a G protein coupled receptor. Okay, and this H1 receptor increases calcium in the cell and it causes contraction and inflammation in the cell. Okay, and this H2 receptor increases CAMP and it causes gastric acid secretions. So these are both are different, H1 and H2. Okay, histamine receptors. So first talk about H1 receptor. Okay, so we all know that H1 receptor is a G protein coupled receptor. So any G protein coupled receptor activates G protein, then it produces secondary messenger, and that secondary messenger produces tissue responses in the respective organs. Okay, so when histamine is released in our body, it binds to H1 receptor, then it will activates the G protein, then it will cause phospholipase C increases. Okay, then the secondary messenger like IP3 and DAZ comes in into the pathway, then it will increase the intracellular calcium. And we all know that when intracellular calcium get increases, then whatever happen, so it simply helps in contraction of the smooth muscles and it activates the inflammatory response in the body. So this is how actually H1 receptors works. Now let's understand how this H1 receptor works clinically. Okay, how it's clinically relevant. So first we'll see its effect on bronchi. Okay, so we all know that in lungs there is trachea, bronchi, bronchioles, respiratory bronchioles and alveoli. Okay, so in bronchi it causes bronchoconstrictions. Let's see how. Okay, so we all know that there is a bronchial smooth muscles in the bronchi. So when histamine released in our body, okay, these histamines bind to the H1 receptor of those bronchially smooth muscles. So when they bind to these bronchially smooth muscles, the smooth muscles contract, because we all know from the very first that how this releases intracellular calcium and causes contractions of the smooth muscles. Okay, so this causes smooth muscles contractions and the bronchi become narrow and there will be bronchoconstrictions. Okay, so clinically let's understand this. Suppose if any patient is having allergy to peanut. Okay, so someone is allergic to peanut, took peanut. Okay, then histamine is released from mast cells in their body, and what causes it causes bronchi to constrict, and that allergic patient will start having difficulty in breathing. Okay, so this is how actually it start, and the patient will develop wheezing. Okay, there will be shortness of breath in the patient and there will be chest tightness. Okay, so this is anaphylactic conditions now. So in anaphylaxis there will be bronchoconstrictions and it's a life threatening. Okay, so in the first line will be you will give epinephrine. Okay, so it will stimulate beta 2 receptor and causes bronchodilation, as we all know from our adrenergic tissue distribution of adrenergic receptor video that beta 2 receptors in the bronchi causes bronchodilation, so we give epinephrine. Okay, so epinephrine act on the beta 2 receptors and it causes bronchodilations. Okay, so this is how if any allergic patient took allergic food items, or if he or she is allergic to anything, then this is how actually the symptoms start. Now we'll see how H1 receptor works in the airway. Okay, so actually when H1 receptor get activated in airway, then it increases the mucus productions. What actually happen? So if suppose there is a histamine release in the body, okay, so it will stimulate mucus secreting gland, and that mucus secreting gland will produce more mucus. Okay, so clinically you can see that when there is a allergic rhinitis. Okay, allergic rhinitis in any person, the patient will develop what? Runny nose, then start having sneezing or nasal congestions, and it is all because of the excess mucus. And how? Because the histamine is producing stimulating the mucus secreting gland and having all these symptoms. So how clinically correlate? So in those conditions we give antihistamines. Okay, so the antihistamines like cetirizine, loratadine or fexofenadine, and it reduces these symptoms by decreasing the mucus productions in that patient. Now let's understand how these H1 receptors work in the blood vessels. Okay, so this is one of the most important effects. Okay, so we all know that suppose if any persons there is release of histamine in any conditions. Okay, so histamine bind to the H1 receptors of the endothelial cells. We all know that in the blood vessels there is endothelial cells. So suppose this histamine bind to the H1 receptor of endothelial cells, then nitric oxide, we all know that NO means nitric oxide. Okay, so nitric oxide get released, and this causes vascular smooth muscles to relax, and there will be vasodilation occur. Okay, but at the same time the histamine also causes endothelial cells to contract a little bit. Okay, and the small gaps between the endothelial cells, and from that gaps, okay, plasma start leaking around, and there will be vascular permeability will increase. Okay, so now we'll see. So let's understand it clinically. Okay, like suppose if any person is having a bee sting. Okay, so after the bee sting the skin become what, red, because of vasodilations. Okay, so we see how vasodilations occur with the histamine. Okay, then the person will have warm, increased blood flow, and the swollen plasma leakage. We also say that how the small gaps between the endothelial cells and causes vascular permeability and plasma leak. Okay, so actually this is how the histamine causes red, warm, and swollen in a bee sting person. So this after there will be classic wheel and flare reactions. Okay, so when you see clinically, okay, so in severe allergic reactions there will massive vasodilations and capillary leakage, and that will cause what, that will cause hypotension or anaphylactic shock. And in those conditions also what we give epinephrine to treat those patients. Now we'll see how H1 receptors works in pruritus, that is itching. Okay, suppose histamine released in the body of any patient. Okay, so histamine stimulates the H1 receptors on the sensory nerve endings. Okay, so suppose this is a sensory nerve, and over its ending there is a receptor for histamine, and the itch signal is sent to the brain, and now these knobs will send back to the brain. Okay, the itch signal, and the patient will feel itching like sensations. Okay, like in case of mosquito bites, or in case of urticaria, or any allergic skin reactions. Okay, so this is how actually we start feeling itching. It's all because of the histamine. Okay, in any case like mosquito bites, urticaria, or allergic skin reactions. So in those conditions also we give H1 antihistamines, and that H1 antihistamine will release these symptoms of itching. Now we are done with this H1 receptors. Okay, now we'll talk about the H2 receptors, which actually increases the CAMP and gastric acid secretions. Okay, so let's talk about H2 receptors. Okay, so it is also linked to G protein S class. Okay, so when histamine released in the body, then it binds to H2 receptors. Okay, then the S protein get activated, then it will increase the adenyl cyclase, then CAMP will increase, and there will be increased acid secretions in the patient. Now let's see how gastric acid secretions actually happens. Okay, so we all know there's a parietal cells in the stomach. Okay, and when histamine bind to the H2 receptors, then that will increase the CAMP, then proton pump like H plus and K plus ATPase become more active in that case. Okay, then the hydrogen ions are secreted in the stomach. Okay, so in the stomach there will be release of H plus, okay, hydrogen ions, and the HCl productions will increase on those conditions. Okay, now let's understand it clinically. Okay, so acid is important in our body, we all know, because acid helps in digestion of protein, it activates pepsin, and it also kills some bacteria. But if there will be too much acid will produce, if too much HCl production will be produced, then will be peptic ulcer disease, gastritis, or GERD like symptoms. So that's why why it's clinically important. So we give H2 blockers. Okay, so those drugs which block these H2 receptors, so there will be less acid secretions like famotidine or nizatidine. These drugs, what it do, it block the H2 receptors. Histamine cannot stimulate now parietal cell of the stomach, and there will be less acid. The acid will decrease, and the ulcers that will form because of too much acid, that will now start healing. So this is all about the H2 receptor. So we have talked about the H1 and H2 receptors and how it works in our body. So this is all about the histamine receptors in our body and how it works in our body. And now in the next video we'll talk about vasopressin receptor. And if you like this video, please share with your fellow medicals and subscribe my YouTube channel and like my Instagram page. Thank you for watching. Thank you.